Well, we continue our coverage of World AIDS Day now by looking at how easy or difficult it is to access treatment, manage HIV, and manage the stigma associated with AIDS. To discuss, we're joined by Dr. Edna Bosire, who is a researcher at the Wits Developmental Pathways for Health Research Unit. Doctor, thank you for being with us. First, can you talk to us about what you observed during COVID-19, during the lockdowns, which we know affected people who need to pick up ARVs at clinics and access treatment?
Thank you so much for having me this evening. Indeed, COVID-19 has really interrupted medication supplies in public health facilities, and also in terms of economic disruption. So some patients are really not presenting at their facilities, some of them lacking transport to go to the facilities, but again, some of them also fearing to get COVID infections when they go to the facilities. And these patients, like the Hospital Association of South Africa has already reported that some of the patients are actually staying at home when they are indeed supposed to attend their appointments. So you can see COVID-19 has not only interrupted clinical supplies, but it has also interrupted economic situation of people at the community. Poverty levels have gone up, and people are now afraid, especially patients who need to engage with the healthcare system, who need to collect their medication, and who needs to see clinicians. So this is a major challenge and a big blow, especially for the fight against HIV/AIDS.
Yeah, it's a huge setback. We followed the treatment options over the years. A cocktail of drugs has come down to much easier options. What is the usual regime nowadays for somebody living with AIDS in this country?
Sorry, I lost you.
If I'm living with AIDS, what is a typical treatment program look like? How often do you have to go to the clinic? How many drugs are you taking, etc.?
So it depends with how people are able to, if they are virally suppressed, really they don't need to keep on going to collect their pills every month. They can get their medication, or they can see a clinician once in 3 months or after 6 months, and then they have to collect their pills at local points closer to where they live. But because of some patients defaulting their clinic appointments, therefore they need to keep on engaging with the clinician until then their viral level is suppressed.
And it also depends on the time to get to the clinic, time at the clinic, if you work, the inconvenience of it. Is it getting better for those living with HIV/AIDS?
So the situation is not really getting better because personally, my research, which goes beyond HIV itself, but looks at patients who have HIV and other comorbidities, you find that first of all, there are longer waiting times. Patients have to go to the hospital, wait for long before they get attended to, and sometimes their drugs stock out, which is a very common thing, and it's because of health system deficiencies. Like public health systems are really under-resourced to take care of these problems. So patients who go to the clinic or to see their clinicians have to wait for long, and sometimes if they have more than another condition on top of HIV, it even becomes complicated because the care is uncoordinated and fragmented, especially in public hospitals. The South African government has really made a good milestone of coming up with the integrated care model for patients who have HIV and other comorbidities. But the problem is that the same health system challenges like drug stock out, staff shortages, and inadequate equipment make it difficult for this model or framework to be implemented. Like I can give an example where I've collected I've conducted studies in Soweto, and you find that this model has not really been implemented in most spaces in Soweto. It's because of the challenges of the healthcare system. So unless these challenges are addressed, then patients with HIV and even those who have HIV and other conditions are still going to have it more difficult. And this is even becoming worse with COVID-19 because COVID-19 has disrupted a lot of things, including medical supplies.
So with in mind this big goal, 2030, sort of the eradication of AIDS, that was the wish. The president saying in his weekly letter that it'll take breakthroughs technologically as well as a fundamental change in behavior. What are you betting on, technology or our behavior changing as a country, among young populations, among everybody?
So look, I think all these factors are important. We really need to adopt, the government in South Africa needs to look at technology, because with COVID, you can see now we are even having interviews on Zoom or online. So there's need to adopt technology, and specifically when it comes to patient information and record and communication, all these really need to embrace technology. But behavior change is also very important, because these are factors that need, like health promotion and behavior change communications need to be implemented at the community level, so that when we have these things together, then patients or young people can be monitored easily. So, so far, South Africa has not achieved the UNAIDS target of 90, because as far as 90% of the population who are HIV positive know their status, we still lag behind in terms of the people who are on ARVs and even those who are virally suppressed. So to say that we are going to eradicate HIV/AIDS by 2030 is going to be even a quite challenge, a very tasky challenge, because Corona has also affected all the plans that were there. But having said that, it doesn't mean that we don't have an opportunity to reorganize, to go back to the drawing board and restructure the healthcare system, use the insights that we've gained from COVID-19, and see then how do we go back and make sure that we attain the UNAIDS targets of making sure that we eradicate HIV by 2030, and how do we handle patients with HIV and COVID-19. And again, just to point, it's important to remember that we are not just dealing with HIV and COVID-19, but we have to remember that many people in South Africa, they have HIV, but they are also co-infected with TB. Some of them are at risk of NCDs, like non-communicable diseases like diabetes. Therefore, we cannot just address one singular disease and forgetting the other diseases. All these diseases must be managed together. Strategies must be put in place to ensure that all diseases are addressed, the health system challenges that exist are addressed, and also issues to do with patients' socioeconomic status like poverty and food insecurity and unemployment. We can never ignore these social factors because they continue impacting how patients access healthcare. They continue impacting how patients are able to afford recommended diets to maintain a good health. So all these factors must be addressed together.
All right, so much to be done, but saying there could be an opportunity to learn from what has happened under COVID-19. Thank you very much, Dr. Edna Bosire from the Wits Developmental Pathways for Health Research.